Good afternoon, everyone. We're going to get started on the webinar. Thank you for joining us. My name is Sarah Mayberry with the Breathe Easy Coalition, and I'm here with my colleague Meg Netto, who's going to be leading up our presentation. Just want to go over a few logistics before we get started. All participants are going to be muted during the presentation. We're going to be saving questions and comments for both staff as well as our presenters till the end of the webinar, but want to make sure that we don't miss any of those great questions that you have. So make sure that you put them into the question box at any time over in the webinar toolbox there. So if you can add those in, and then we'll make sure we go through all of your questions at the end. Also, this webinar is going to be recorded and posted on two places. Both our BEC YouTube page will hold our recording, as well as it will be posted on our SlideShare page to get the slides and information. And as we go through the webinar and go through what some of our resources and contact information, we'll give you those websites again, as well as sending those out to you. But without further ado, I'd like to turn it over to Meg, who's going to lead up this presentation. She's a community health promotion specialist here with us at the Breathe Easy Coalition and leading up our tobacco-free college work. So I will turn it over to Meg.
Awesome. Thank you, Sarah. All right. Just click on. All right, so our outline for today, we'll do a quick overview about Breathe Easy, make the case for tobacco-free colleges, and then talk about the changing landscape of college policies. And then we have two fantastic success stories to share with you. We have Leanne Dodge, who will talk about the University of Southern Maine, and Cynthia Forrest with the University of New England. And then some quick resources and tips for tobacco-free colleges if you're listening and have not transitioned yet to a tobacco-free campus. And then we'll go over your questions. So who are we? The Breathe Easy Coalition is an umbrella organization made up of the Smoke-Free Housing Coalition, the Maine Tobacco-Free Hospital Network, Maine Tobacco-Free Behavioral Health Network, and the Maine Tobacco-Free College Network. So you can see our mission here is to reduce exposure to secondhand smoke through the promotion of strong voluntary policies that lead to reduced tobacco use and increased tobacco-free living throughout Maine. Specifically with colleges, we're dedicated to providing Maine's post-secondary learning institutions with the information and resources needed to create tobacco-free campuses. Through providing technical assistance to administrators, health centers, student advocacy groups, and public health advocates in order to encourage that change. So, why tobacco-free campuses? I'm sure most of you are aware of these things, but there are no safe tobacco products, and tobacco use continues to be the leading cause of preventable disease and death in the United States. So creating tobacco-free areas changes the social norm around tobacco use and promotes tobacco-free living. You know, we hear from a lot of tobacco users that they want to quit, and by having policies that require them to not use tobacco in specific areas kind of helps them along that change continuum and wanting to quit. And then 98% of tobacco users begin before the age of 26, and 28% of college smokers began to smoke regularly at or after age 19, which is when they're already in college. So if we can kind of prevent them from even starting, the likelihood of them continuing or ever picking it up after college decreases their chances. There's also no safe level of exposure to secondhand smoke. So even brief exposures can cause damage that lead to serious disease and death. And this was first reported in the Surgeon General's report in 2006. And then secondhand smoke contains thousands of chemicals. At least 69 of them are known to cause cancer in humans. So non-smokers exposed to secondhand smoke have an increased risk of developing heart disease and lung cancer. And this poses a risk even outside. So research finds that smoking within 20 feet of a non-smoker can cause harmful levels of exposure that can be as high outside as they are in indoor environments. So it doesn't matter whether you're inside or outside, exposure to secondhand smoke is happening. And then the other piece that a lot of students we found are really kind of more passionate about this is that tobacco products create a lot of litter. So cigarette butts are the most littered item, and tobacco-related litter can have negative effects on the environment, and up to 90% of cigarette butts are actually disposed of improperly. And then there's the use of emerging tobacco products, including electronic cigarettes, that are gaining popularity among youth and young adults. So here's a picture of one. Apologies for the phone ringing. So there is not enough research out there right now to know whether you'll hear people talk about whether e-cigarettes are good for you or bad for you. But ultimately, there's still a nicotine addiction, and there are negative health effects associated with them. So, tobacco-free campus policies, they create healthier and safer environments for students, faculty, staff, and visitors. Tobacco-free campus policies support healthy social norms that don't include tobacco use. They remove exposure to secondhand smoke on campus. They support those who are trying to quit or who have recently quit, stay tobacco-free. And they show the school's commitment to a healthy environment. And the schools, and I mean the Breathe Easy Coalition and Maine Tobacco-Free College Network, were not the only ones doing this. So the American College Health Association released a position statement in November of 2011 on tobacco-free colleges and university campuses. There's actually a webcast recording of the Assistant Secretary for Health and Human Services when they rolled this out that you can watch, and we'll send you that link as well. But it is a growing trend in the state of Maine. So Maine has strong smoke-free laws that protect residents in indoor environments, including workplaces, bars, restaurants, outdoor dining facilities, in cars with children under the age of 16. And we're liking to expand that more to outdoor spaces, including colleges and universities. So nationally, more than 1,043 colleges and universities have adopted 100% tobacco-free campus policies. If you look at schools with smoke and or tobacco-free policies, that number is actually over 1,500. And then more than 630 of those schools also prohibit e-cigarettes. So now we have some great success stories to share with you. So up first is going to be Leanne Dodge, who is a prevention specialist with the Maine Office of Substance Abuse and Mental Health Services, but she is formerly the Assistant Director of Student Life and Coordinator of Substance Abuse and Wellness at the University of Southern Maine. So we'll let Leanne take it from here.
Great. Well, thank you guys for having me. And so we'll just get started with the next slide. And as we go through this, if people do want to contact me later, feel free to, I think these folks have my information if you want to have follow-up down the road or more questions. So just a few pieces that USM went tobacco-free on January 1st, 2013. And this has been a long time in coming at USM. So they did work on this in the 90s. And if you think back of how this kind of progressed at certain points, we no longer allowed smoking in the residence halls, which, as you think now, like, I can't believe we let people do that. And if you think of filling out your application to go to college, they used to ask if you were a smoker or not, and then they'd match you with other smokers or non-smokers, and then of course some people lied because their parents were there at the table, so you didn't say you were a smoker. And so we've come a long way in that regard. And then it kind of moved to, well, let's make sure people, so you can't smoke in the buildings, but you can smoke 25 feet away or 50 feet away. And so that was really always hard to figure out, well, how far is that? And what if it's a snowy day? Can you get a little closer? Or some campuses would have smoking benches where, they were painted a certain color to show, like, you can smoke on this bench. And then, so that kind of would get confusing. There'd be maps of campuses of where you can smoke and where you can't. So in a lot of ways, having a tobacco-free campus makes it easier to enforce because it can't be anywhere. So at USM, I was just there this weekend. I no longer work there, but the signs say this message. This is a 100% tobacco-free campus, and we appreciate your cooperation with university policy. Breathe Easy, you're in Maine. So connected to the larger Breathe Easy campaign across the state. And also back in the day when they first started, they had some messaging that was like, life is fair, no smoking and stuff. And you think about the way to word things is really important, so that it is also, a wellness kind of approach rather than, shaming or like, too bad, life is fair, you're not allowed to smoke. So really changing the tone so that it's this positive wellness approach. So if we could go to the next slide. So just some steps to take when you're doing some of this today is getting advice and the process from other colleges or universities that are similar to yours. So first of all, we followed Orono's lead, and they really did the heavy lifting. So if you know anyone or is anyone here connected to Orono, thank you for all the work they did. They spent a number of years doing the heavy lifting. They did town hall meetings, as it were, on campus, and really did all the work to figure out what's the best approach to go tobacco-free. So they really took the lead for other universities in Maine, part of the Maine system. And, and it was really hard. They're folks that led the initiative. People got really angry about it. And, there's some crying involved even. So we really benefited from following what Orono did and their advice. So again, I advise people doing that in looking at colleges that are similar to the ones you have and some of those unique issues. For USM, we have both the residential campus, then we have 2 other campuses that are in cities, and kind of looking at all those different pieces. The other person is that we really worked with was Sarah Mayberry, who's on the call today. So really, connecting with the Breathe Easy folks to be part of your process. It's so helpful. And as they said, Meg shared earlier, when we first started, there was only 350 nationwide campuses that went tobacco-free or smoke-free. So that now to see that over 1,000 is really helpful. That's about a quarter of the universities in the country. So you have more leverage, like, hey, this is more of a norm that campuses are tobacco free. Another piece, step 2, is to, you got to meet with your administrators first. And some universities or colleges will, the president will just say, hey, this is what we're doing. And we went through some presidential changes. So when we first, really wanted to go tobacco free, the president at that time said she really wanted it to come from the ground up, from the student, staff, and faculty, get their input, and all of that. Then we got another president who was like, this is going to happen. We're doing this. So it was interesting. We kind of had to do it. We did it both ways in a lot of ways. So the other thing, step 3, is to meet with key stakeholders. And so that includes staff and students and faculty and union members or unions, because everybody has a union representing, so you have to work with them as well. And then the senates, so there's senates for each of these groups. And that's what we did. We met with them and spoke with, and proposed with them what that would look like to try to get their buy-in. You had some faculty that said, oh, the next thing you're going to do is say we're not allowed to have sugar or desserts at our lunch, and so you had some of those, that end of it. But for the most part, people were on board with making this happen at USM. And as really thinking you're going to have different people focuses for different folks, and to know, really think of the differences that might affect people. So for some folks, it's the wellness approach, that they, again, don't want secondhand smoke, or they would like to quit. The environment, like Meg was saying, butts. We had a tour of like sophomores coming to USM, and they walked through this one building, and as they were walking in, there were like thousands of cigarette butts right as they walked into the building, like right outside. And you could hear them mentioning, like, wow, a lot of people must smoke on this campus. So again, it's different pieces for different groups and people. And, you know, that whole folks with asthma would complain and say, look, there's people smoking right outside my office and it shoots right up into my window and I have asthma. So it's that kind of piece. And then it's also, you know, think of it to go tobacco free. So that includes chewing tobacco. You think of our custodial staff had to clean up lots of spit in showers and nastiness, and then also in athletic facilities down the staircases there was, you know, chew from our athletes down the stairwells that custodians were picking up, and that was really not good. And as you see on this slide, they figured out it was about $40,000 a year to pay someone just to pick up the nicotine, just the butts, now let alone the spit. And we would talk with custodians like, you need to charge, you know, the students for that or the floor, and they go, oh, I don't really, you know, I feel bad. But can you imagine cleaning up, you know, tobacco chew? So thinking about really going tobacco free and including e-cigarettes, I think is important. And my secret side dish was to work on marijuana with this, because a lot of times students would, you know, smoking marijuana out on a picnic table, and then they kind of like, oh, I'm just smoking cigarettes. So again, a little side piece. Or if you smelled smoke in a residence hall room, you know, it really kind of cutting back on that. Like there should be no smoking of anything on a campus. So it's important to do environmental strategies. All of these things need to be in place as you think about it. So you want to educate people. Signage needs to happen everywhere and reloaded every semester, because there's new students, new staff every semester. We had a poster contest to develop our messaging, which was really cool, and I think you saw that in the beginning, some of the artwork that was done by students. And one thing I saw up at Husson, they had great t-shirts for their orientation leaders. So as people were coming on campus, they got a nice message from all the orientation leaders about what was happening. So the signage is important. Also, you need to put in place, what about people, so if we're saying you can't smoke or chew, you have to have some cessation services in place for people. And not many will probably take you up on it. It was our experience. However, it needs to be something that's offered, or at least, you know, phone numbers for people to helplines and stuff. And really using a motivational interviewing approach with this, with being non-judgmental, non-confrontational, understanding that nicotine is the most addictive substance and is one of the hardest things to quit, so that it's not just that secondhand smoke approach, like you're ruining all these other people who are choosing not to smoke, which is definitely key, but also, hey, we understand this is hard, and we're asking you to make a change, and thinking about the stages of change, moving people from pre-contemplation to contemplation to action and to hopefully quitting. And then how do you enforce this? That's always the question. Who's going to enforce it? Well, it really has to be everybody. And so sometimes your campus security or police will say, look, we don't have time to go around and, you know, catch people doing this or write citations, or how's that going to work? In some cases, you will have their support to help with that. But really connecting with staff that makes sense, the residential life staff, and having the expectation that they would approach a student who's outside their building or somewhere on campus and let them know about that, hey, this is tobacco free, you need to go, and this is where you could smoke, which is over at the sidewalk or whatever. But it's really everybody's job. And then also, if you have reoffending students, that you have a process in your conduct office so that it is a policy. So people, there are consequences if someone continues to break that policy. I know I ran a couple of wellness centers at USM, so my staff, my work study staff, that was an expectation that they could, you know, approach people. And we had gum, you know, sugarless gum in little cards with information that, you know, so again, it wasn't, hey, you know, you're going to hell if you don't stop smoking, but hey, just to let you know, this is the policy and we need you to not be smoking right here. And especially staff too. We had our dining staff were really, they just stood around this one bench. You could always see a little cluster of the chefs in their little coats and stuff smoking. And so it was really good to get their boss on board to say, this is not, you cannot smoke. This is part of your job, and that you have to obey this campus policies. Also letting other people know outside of your regular on-campus people is visitors, people using the buildings for conferences, athletic events. All those folks need to know what the expectation is, and really knowing that this is comprehensive. So the next slide is some advice. And so again, making it comprehensive, tobacco versus smoke-free, including all the different products. And even in cars, that was, just a recommendation, is that, people, obviously it's going to be hard to like go up to someone who's driving by and saying, hey, you're not allowed to smoke in your car either, but it's more about sitting in a parking lot on campus and smoking. And sometimes people said, why don't you just have a gazebo where people could smoke and just kind of cluster them in. Again, that's not really in line with the whole wellness philosophy, because what you're saying is, hey, we're tobacco free, but not really. So I would advise against not having a spot where this can take place. You need funding for the signage and marketing for this, and again, ongoing, and all the people that need to be educated. So leaving things on the beds in all the residence halls when people move in, and even during orientation. And sometimes people will say, well, I bet this is going to affect admissions. You're going to lose a lot of people. You're going to lose a lot of smokers who aren't going to want to come here now. What we found is really the reverse, that more people were happy that it was tobacco-free. And we're glad that it was an expectation not to. And as Meg was saying, a lot of students start in college, and mostly because they want a study break. So again, as an environmental strategy, you need to provide alternatives for smokers, offering ways for people to relieve stress if that's something they're doing. And again, people starting, so is there any healthier way to message, like it's important to take a break every hour when you're studying and to get enough sleep and all of that. What do you provide for people as a study break? And that's, again, a social thing where people might connect. I had one student that she was kind of isolated, but she found she could make friends if she was in that smoking circle, and would even provide cigarettes just to make friends. And, it just saddened me that we need to find other, socializing opportunities and stress relievers and all of that approach. The other thing, it's important to let people know at least a semester, give them that time to transition. Again, you might have out-of-state students coming, and that was a concern, that people were like, we're forcing these students to go out at night, in the middle of the night. There's a safety concern that they're now walking down into, the town or the city to smoke. And I wouldn't put a lot of energy into addressing that as a concern. And that's a choice someone is making, and they'll have to, get a buddy to walk with them, or, that kind of thing. But give at least a semester to let the campus know this is coming, this is going to happen. And meet with the neighbors. So in Gorham, we had, that was a concern, is like, are all these folks going to be just hanging out on neighbors' lawns and smoking cigarettes? And at times there was an issue with that, and we addressed it and put up some more signage to let students know. The residential life staff reminded students that they'd be held accountable, and that that's not appropriate for them to be going down there. So the last slide I think I have is next. What would I do differently? What would we do differently next time? We would get more students involved. In some ways, I don't think we gave them enough voice in this happening. And we did have them, they voted on it with the, the student senate. They also put a vote out to all the students about if they were for or against, and it was about 50-50. But I think we should have timed it better when we asked students. We knew that it was going to happen, but really to get more students involved in that. And one of the key things is, so you have students that are going to be there a few years. you might have staff and faculty that are going to be there for many years. So kind of weighing that out too, staff, students, faculty, although students are our customers and why we exist, we also need to get that buy-in from staff and faculty. Would have liked to see more people on the coalition working on it. You know, it was all the key usual suspects for health services and employee wellness and my job as substance abuse person and wellness. But it would have been great to have even more people involved. And one of the tricky things is if you don't smoke and it's not an issue for you, you might not really be that fired up about it. If you do smoke, you know, then you're probably fired up about it. So how do you get people interested? And so we did do some work with that a lot of people in life have tried cigarettes. A lot of people have folks in their lives who are struggling with that addiction. So again, having more people involved. And then keeping up the momentum, this is something that's just ongoing. You've got to educate people and again, continue to intervene and continue to enforce. It's never done, again, with that students coming in and out. You know that you'd have to, it's not a dissolving work group that works on it. It's going to be ongoing. And then another thing to work on next time, I would have had more success stories from people who quit, because a number of people did, and they thanked the group for making it go. It really forced them. You know, some of the staff and employees really had to quit, and they really were appreciative of that. So I think that's helpful. And then really thinking about, just remember that this is about changing behavior. That's the eye on the prize. You really hope that people don't start, or if they start or do smoke, that they think about quitting. And really educating folks versus shaming or punishing people, but more like, hey, I understand that this is really hard, and what can I do to help you? And maybe even if you might not get everybody to quit, obviously, but getting them to change behavior. And you're not going to get everyone not to smoke on campus. There's always going to be pockets of secret hiding places that people might do it. And not to get like enraged, because you can look at USM, just it's so great not to see people smoking on campus, or tons of butts, or people complaining about their asthma being affected. So it's a process. It's never going to probably be 100% anywhere, but it's going to get better. So that's my thoughts, and I pass it on to the next person.
Awesome.
Cynthia.
Thank you, Leanne. So up next we have Cynthia Forrest, who is the Vice President for Student Affairs at the University of New England. So Cynthia, we'll get to your slides. And if you just want to tell us when to click next, we'll advance your slides for you as you talk.
Okay, great. Well, good afternoon, everyone. Our journey was a long journey, and I think certainly Lee talked about the process, and I think the process is part of the journey that's really important to pay attention to. As we think about moving in a direction of dramatic change, which such a policy really is, it creates a lot of angst among people who are in the environment at a particular point in time. Our conversation, and you can go to the next slide, our conversation really was based on a community process that really was launched by our University Wellness Committee that included predominantly faculty and staff. And one of the things that the group did is they went around to each of the constituent groups and talked about the need to develop a policy that in fact would move the university forward. And of course, the University of New England is, our tagline is an innovative health sciences university grounded in the liberal arts. So what we had, because we're an institution that has been on a fast track of growth, the health professions have really continued to be the growth area on our campus. And so what we had really was a lot of consensus among faculty and staff. but where we found our challenges really focused on specifically the undergraduate student government and students, because when the conversation started, this was 2010, while there was an awareness of the need to focus on the impact, the passive impact of tobacco and smoke, there had not necessarily been a lot of conversation before this committee launched its kind of campus and university-wide conversations. So at first, the undergraduates really framed the issue, which is not uncommon, I don't think, developmentally, as a rights issue. We have to protect the rights of those who smoke. And then, of course, on the other side of the conversation was, well, what about the rights of everyone to have clean air? So that's really how the conversation was framed in the very beginning. And so the student governments became the real important players, and the president visited each of the student governments and talked with them and made it clear that she really wanted students to wrestle with the issue, because that's the constituent group that would be most impacted, and specifically the undergraduates who live there in our residence hall communities in a 24/7 basis. So while, you know, part of her, and she shared this with students, would be to say, you know, it's the right thing to do and I think we should do it. She said, in order for the change to be effective, students need to wrestle with their colleagues and to have the conversations that would ensure that we developed a consensus of opinion, and that people in that conversation would be committed to promoting and supporting new norms. So student governments, being the kind of groups that they are, obviously particularly the undergraduate student government, wanted to ensure that every single student had a chance to weigh in, and so they put it to a vote. And so the initial vote was clearly still a lot of support of people, in fact, saying that, you know, we need to allow smoking to occur. So that first survey was done in 2010. So the conversation continued, and one of the key groups, you know, is the leadership of all the student governments. And so while the undergraduate student government was conducting surveys, we continued to have the conversation in what is called representative council. And I led the conversations, and that was a council that was comprised of each of the student government presidents, and we have three. We have the undergraduate, we have the osteopathic medical college student government, and we also have the graduate and professional student government up on our Portland campus. And so the graduate programs really didn't need to vote. They didn't feel the need to have a vote, but the undergraduates did. And so they decided, because we continued to have the conversation, representative council, which also included our 2 student trustees, plus the associate dean for constituent services from the College of Osteopathic Medicine, as well as myself as vice president for student affairs, the dean of students, as well as the assistant dean of students for graduate and professional student affairs. So we continued the conversation, and USG says, well, we want to check with our constituents again. So they launched another survey in 2011. While there was movement, they still weren't satisfied that they had the mandate from their constituents. But this remained on the agenda of the Student Government Association, Undergraduate Student Government Association, and was revisited every year by the graduate and professional groups. So basically it took almost till 2012 till, I don't know whether people succumbed or the generation of students changed, But USG at that point felt as though that they had seen a shift in student opinion. And also they had worked very closely with the resident assistants who were nervous about the implementation and their role in enforcement. The Residence Hall Residential Student Life Association, which represented hall reps from all of the different residence hall floors, were also continuing to join the conversation, because that's another group initially that voiced a great deal of concern in change. So finally, around 2013, we had a draft of a policy that actually was shepherded and vetted by the representative council. So we had all 3 student governments reviewing, and we also had the kind of leadership of our 2 student trustees, and of course every year we get new student trustees, and we also often have changes in student leadership in those key student government positions. But there was such a commitment on the part of our student trustees that they really, in fact, passed the torch from generation of student trustees to the next generation. And so finally in 2013 we had a draft, and actually students did a lot of research, because when we first presented the draft it did not have an enforcement component, and the student leaders said, you know what, we really need to outline and articulate the consequences for people's compliance with the policy. And so they did research, and our compliance strategy really emerged from their recommendations. And so it was at that time that the policy was in the kind of shape that would allow it then to be presented to the University Council. And the University Council represented all the deans and all key leadership of the university. And that group reviewed the draft. There were a few recommendations that were made, and the passage of the policy finally occurred in 2013. In the discussion about the time of implementation, the students had recommended that it be implemented July 1st, 2014. So they wanted to have a year of conversation and the work of committees to, in fact, develop an implementation plan that was comprehensive. And they also were very clear. They wanted to make sure that we had done outreach and through our student health services, so that people understood the resources that were available for smoking cessation groups, and then also the employee assistance programs through our health plan was another resource that was highlighted for faculty and staff. So despite the fact that the university leadership, were anxious to get moving, the president was very clear from the very beginning, including at that moment, that the students would be the group that would make that decision about implementation. So with that, we launched an implementation planning committee that included, actually Meg was on the committee, and included constituents from every group, faculty, staff, students. And there was really a great deal of investment in that group, in making sure that they thought of everything, they used creative strategies, they developed the signage, everything that Lee had outlined as critical points of implementation. And so we had a very successful and uneventful, in a lot of ways, launch a year ago this July. And we have seen the impact. One of the things that the group made sure immediately to do was to ensure that all the smoking receptacles were removed. So the vestiges of the past were purged from the campus, and I think that we really have not had many complaints over the course of the last year. And the work has also been done with our food service vendors because that workforce, there was a high percentage of smokers there. And so there has been compliance. And part of the compliance, really, that students outlined in their recommendation, and that was in fact passed by the policy, was that, you know, if it was a student violation, the student judicial system would be used. If it were a faculty or staff violation, then the kind of supervisory role would be employed so that there would be the kind of conversation that would ensure that as we move forward, staff and faculty would be in compliance. So as I think about the reasons for our success, I think that we had a president who was very committed and who understood the importance of the student role in creating the norms, changing the norms, creating the norms, and supporting new norms. And and our student leadership was critical. I think the fact that we had a very student-centered process, the meetings, the surveys, people were engaged and students knew that their opinions really counted. And then I think the Wellness Committee certainly had the broad-based representation that ensured that this was no surprise. And I think the fact that we moved over 3 years or more to implement from discussion to kind of understanding what was going on with students, and then certainly the Wellness Committee celebrated and were actively involved in the Implementation Committee. Then I can't stress enough the importance of our University Board of Trustees. They themselves were in our Student Affairs Committee of the Board of Trustees. They spoke very strongly and positively about the role of student leaders, but they also urged our student leaders to move with kind of full force in their roles, and they implored them to consider the health impact. So our trustees were wise men of counsel and women of counsel who supported students, but also ensured that students had a clear sense of what they had hoped and envisioned for the future of the university. And then, of course, I think as we've talked about, the education and support opportunities are so important, so that as you move toward new norms, you support people in the change of making different decisions about their health, and that, again, that impact of a positive approach, as Lee stressed, is critical. And then I think the implementation that was of the Planning Committee and the support that we received from Meg, who was the coordinator of the Coastal Healthy Communities Coalition on our campus. So I think that it's the process that you use, the constituent groups involved, and then being absolutely focused on a future outcome, but not being wedded to a timeline that moves ahead of the attitudes and spirit of your campus. I think those pieces, as I look back, those pieces were critical moving forward. And our implementation was and has been a really positive change for the community. As you talked about, the environment is healthier. The litter is no longer there. So it really has created the aesthetic appeal too for new visitors as well as new students coming in, families. And we did have families in the past before we changed that commented on the smoking in a not so positive way. So I think in moving in this direction, it was a really positive shift for our university, and a shift that was celebrated by all constituents because we had the patience and allowed the time for the conversations and the change that would ensure a successful implementation. So thank you for the opportunity to talk about the journey, and I look forward to your questions.
Awesome. Thank you, Cynthia. So we'll just finish up. We have a few more slides here, and then we'll go back one. There we go. Then we'll follow up with the questions. So the steps for creating a tobacco-free campus, as much of a journey as we've heard it can be from Leanne and Cynthia, the steps can fit on one PowerPoint slide. So, establishing a policy committee or work group, determining your policy parameters, and then developing a draft, including that timeline, policy language, enforcement strategies, building support of key stakeholders. And I mean, those things can be done before steps 1 and 2, depending on your campus environment. Positively communicating the policy change to your campus community, preparing signage, and I feel like that's one that we heard from both Leanne and Cynthia is one of the most important pieces, is giving people that time to swallow the fact that this policy change is coming. Prepare and distribute educational materials on the policy, tobacco use, quitting, secondhand smoke, to all of your population, so faculty and staff, students, visitors, contractors, and even campus neighbors if applicable. And then implement and enforce the tobacco-free campus policy. So it looks like it can be really easy, but we've heard it can be a lot of work. And having been involved with the policy change at UNE, it is a lot of work, but when you create that sense of community approach to it, it can be very successful. And then some reminders, some key talking points for the tobacco-free campus policies. So tobacco use continues to be the leading cause of preventable disease and death in this country. And it's about the smoke, not the smoker. We hear a lot from students, and Cynthia had mentioned it, that especially undergraduate students come in and they talk about it being a rights issue. So a tobacco-free campus policy isn't saying you can't smoke. It's just saying you can't smoke here. I mean, we obviously encourage people to quit using tobacco because of the health effects of it, but that doesn't have to happen if it's a personal choice that somebody has no intentions of quitting. So secondhand smoke travels and it's harmful to others, both indoors and outdoors. We've heard about some of the costs and savings with adopting tobacco-free policies, and then communicating and educating about the policy is key to its successful implementation. So the Maine Tobacco-Free College Network has a bunch of resources. There's the link to our website on your screen. So we have a toolkit that includes sample policy language, frequently asked questions, press releases, sample letters to neighbors, faculty, staff, students, model signage. We are actually in the process of updating this toolkit and should have it out later this year. And then some additional materials. We have a tobacco-free campus fact sheet, and we'll have an infographic coming soon that we're really excited about. And then with that, we have some questions that people have written in. In addition to these resources, so we have the Maine Tobacco-Free College Network website, the Breathe Easy website, email and phone number there, Facebook and Twitter, and then the presentations on YouTube and SlideShare. And then we actually will be also sending out a survey to all of the institutions of higher learning in the state to kind of assess where they are with their policy and how the Maine Tobacco-Free College Network can help with either policy implementation or ongoing support and education if need be. So I will let Sarah cover the questions that have been asked.
Great. Thank you so much, Meg, and thank you to Cynthia and Leanne for being on here and making sure that we are able to share some of the success stories, because we know that that goes a long way in getting to the point where people know, I think as Leanne had mentioned, where people know that this has worked, and as we see more tobacco-free policies that are working. So it is, our first question is, can we use all of the info in the slides? From the Breathe Easy Coalition standpoint, absolutely yes, and we have worked with our presenters to make sure that this could be made available. so that we will put this on there, and we can work with you to provide that. And we also will send out the slides, and definitely feel free to use this information. I think one of the hopes here, as we see as the coalition and as we've heard from some of the policy changes, are the fact that there's no need for every school to reinvent the wheel in working on this. I thought we saw a lot of great themes between all three components here, and so trying to find ways to make sure that can be utilized and utilize those long processes that people have gone through and what they've learned for change. So absolutely, we'll make sure that we send that out, and please feel free to use this information. Our next question is just one that was about cost. We had, so just asking if either school, if there was a budget associated with going tobacco free, and if you found any significant costs associated, or if that was something you were able to absorb. We know we talked about signage, but just curious about that.
I was thinking about it. We probably at UNE, and Meg, you can chime in because you were part and parcel of this. We probably spent in the neighborhood, I would say, of $3,000.
Yeah, I don't remember what the cost for the signage was, but we had done so at UNE there are metal signs on all of the parking lot signs, and then Cynthia had noted that the partnership with Coastal Healthy Communities Coalition, which is the local health humane partnership that covers that area where UNE sits, we helped cover the cost of some of the reminder cards that were ordered that are placed around campus, so that somebody can carry one of those and then go up to somebody and say, if they saw them smoking or something like that, that says, are you aware that UNE has a 100% smoke and tobacco free campus? But Cynthia, I would agree. I don't think it was more than $3,000, if that.
And I think at USM we had some funding. Sarah, you helped connect us with, probably through your office or Health Humane Partnerships.
Absolutely, the same thing. I'd say a great resource is the local Health Humane Partnerships, and we can definitely help if you're not connected to your local HMP, which there's one in each community, that they're a great public health partner who can help work on a variety of wellness issues, including tobacco policy change, and oftentimes are great to connect with on this, and know that they're sometimes able to help through mini grants or components to help make sure that education and awareness is there, because that signage component. One of the things we do have at the Breathe Easy Coalition is some template signage with the language that you're looking for, but unfortunately we can't provide metal signs because we know everybody likes to brand them personally. There can be a cost, but I think it's something to make sure when you're thinking about another component of your timeline as you're looking at this, is thinking about that budget. While it can be very small, just to have that in your mind and try to think of how that can sort of work through those different components. So we have another question, which was, how can I find out more about other schools' policies and the changes? I think that's a great question based upon Leanne's comment of saying following another school. If you want to contact here, again, the Breathe Easy Coalition staff, we can connect you with other similar size schools. We track all of the policies for all of the schools across the state, especially when they're going tobacco free, and try to be supportive in that and have information about those changes. And as Meg noted, we have the national numbers there, so we can maybe sometimes look even outside of Maine if you're looking for something comparable, just to learn a little bit more about what's going on with tobacco free policies. So please feel free to connect with us, and we're happy to work on that. As we're seeing, it's an exciting time for tobacco-free campuses, as we're seeing a real jump in the number, especially over the last couple of years. It really is exploding, which is exciting to have that American College Health Association supporting this policy, seeing local changes that are, I think, become more and more common, as well as seeing the federal level that the CDC is supporting this. So it's an exciting time. I'll give it one more second here to see if we have any more questions that pop in. And so I'm not seeing any, but I'll give a quick, either Cynthia or Leanne or Meg, do any of you have any closing thoughts or things that you want to share before we thank you so much for your time?
I think for me,
just-
this is Cynthia, having patience
Mm,
and really listening. I think facilitation skills are also really important
good one.
so that you honor every perspective, so that there's a process that respects the voices from all the constituents. And I can't stress that enough. And, you know, our president on several occasions made her priority for that process very, very clear, that and really the notion of students being important leaders in the process makes a tremendous difference, I think, in the outcome.
Awesome. Thank you very much. And Leanne, I heard you chiming in there.
Oh, yeah. I always have things to say, of course. So, yeah, I think that, you know, the one cool thing, one of our health services nurses did this process with us, which was a storytelling piece, and, you know, the committee and then some other folks, he just kind of went around like, how has tobacco affected your life? And it was very powerful. And I mean, I'm almost in tears now about people losing important family members to it. And to really think about what you could be preventing, and just hearing those stories were powerful. We also did an art contest for Red Ribbon Week, which was really around alcohol prevention, but we had people submit artwork around substance use in their lives, and one person did this cool paper mache heart and lungs, and she submitted it and talking about her grandfather that died from tobacco use. And, you know, so there's some different ways to do some education in a, you know, a non-judgmental way, just to get people to think about why we're doing what we're proposing to do is really about health and wellness, and that we do want people to have stress relieving techniques that are healthy, that, you know, our saying was get well, be well, stay well. And we actually want to teach students while we have them about life skills to take care of themselves. And, you know, that's a responsibility for us. And if we can prevent people from even starting or helping support someone quit, you know, you think about students have free counseling usually on campus. This is a perfect opportunity to get some help with that. So, you know, what better place to help people than at a university or a college?
Those are great points. Thank you so much for sharing that. And I think it really does reframe and bring us back to really why we're taking on these wellness efforts on campus, and why that patience that Cynthia mentioned is so important. So thank you all. Thank you very much to our speakers, and also for all of you who joined us today. Be on the lookout for an email from Meg. We'll be sending out the follow-up with the slides, and please let us know if there are any ways we can support your efforts. So thank you so much.